Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Hello, Dr.
Nita,
Darrow.
where are you?
Hello.
There you are.
Yes.
Yeah. Can you hear me?
I hear you
right.
fine. I don't know. This was just a secondary glitch, but our genius Alex took care of it right away. How are you today?
Thank you, Alex.
Yeah. Props for Alex.
I'm living it up as always.
And I'm great as always. So let's talk about what we're doing here today. Our program.
Well, the first thing we got to do is we got to take care of Vic, Maria, and Roxanne.
Okay.
They come in and see me.
Okay.
And they just sent me an email saying they haven't heard their jokes lately.
Oh.
And they said they sent me about 4 of them. So I'm going to tell you one right now. You ready to get stumped?
Ready. I'm always ready.
What does the sun drink out of? Sunglasses.
Oh my God, that's hilarious.
How do you get in touch with the fish?
Swim?
You drop them a line.
Oh my God.
One last one.
Right.
You ready,
I'm
Vic,
dying.
Marie, and Roxanne? What's the coolest letter in the alphabet? Iced tea.
Oh, these are good. They send you good ones.
Don't they?
They do.
Yeah, thank you guys. I
Yeah.
appreciate it. Keep sending the jokes.
Props for Vic,
And I'll
Maria,
take
and
care of you
Roxanne.
here.
I love it.
Yeah,
Okay.
they're great people.
So, and the 3 of them, you're taking care of them, so they're not going to call because they're not in pain?
Well, they hopefully are all better.
Okay, well, if they're all better, then let me talk to the listener who is not all better yet. If you're having musculoskeletal pain, that's basically orthopedic pain. You have muscle pain, joint pain, tendon pain, ligament pain, disc pain, back pain, neck pain, knee pain, hip pain, arthritis pain, stiff joints, dull aches, anything like that that you suspect is orthopedic pain. Give Dr. Darrow a call right here, right now in the studio at 866-870-5752. That's 866-870-5752. Right here in the studio, and you can talk directly to him and see what's going on with your pain. It's a great opportunity, and if you are a first-time listener, you want to see what's going on a little bit, check out the website at www.lastemcells.com. That's www.lastemcells.com. You can email Dr. Darrow off of every page on the site, and watch him performing the treatments on videos. So if this is brand new for you, that's a good option. And we are here Saturdays at 10 a.m., again at 1 p.m., and when you call the program today, here's the best part. Second best part. First best part is they talk to you, but second best part is you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. It has 264 scientific studies for real. The foreword is written by Suzanne Summers, and you two have worked together off and on for many years. That's pretty exciting stuff.
Yeah, she's written a few chapters in her books about me, so thank you, Suzanne Summer. I appreciate that. She loves to get out the word to the world about things that can heal naturally, which is what my regenerative medicine does, using platelets or stem cells from a person's own body. And it's an amazing thing. I've been doing this work for, since I think 1997, something like that.
Wow.
When I used to have hair on my head.
Yeah, and I was just coming out of grammar school.
Nita.
Why is that so funny?
To see little cute Nita all dressed up by her mom.
Yeah, that was a scene. Well, we also want to tell you the byline of the show, which is relevant to the fact that you do regenerative medicine, because the byline is take the surgery out of pain.
Yeah, and then in the book that you're going to get for free by calling me right now at 866-870-5752. I'll repeat it while you grab your pens and pencils. It's 866-870-5752. We're at the studio now, and we're waiting for your calls. I love my callers. Nita and I have a good time with you. We love you.
We do.
And when you call, we're going to get a free copy of my book of stem cell and platelet therapy. And the byline to this book is Regenerate, Don't Operate. And it has 250 or so studies showing why you'd rather do regenerative medicine, which is just a few injections, walk in the office, get your injections, and walk out, rather than having surgery, which is replete with so many different types of side effects. I don't want to go over negativity right now and make you feel bad, but a lot of you who are listening have had failed surgeries, and people come in and they're worse after they have surgery than before they were before the surgeries. And Nita, if you don't mind, I'd like to take a question that just came in. I had about 15 emails that came in.
Okay, but just so you know,
wait.
we do have Kelly on hold in San Pedro.
Okay, this will just be a real quick one.
Okay, hold on, Kelly.
Kelly, hang with me a second. Will this procedure help someone who has already had knee replacement surgery? Okay, and then I write back everybody who emails me, and then this person wrote back and said, I have had 2 replacements of my left knee and cleanouts for scar tissues both time. Also had my right knee replaced for scar and had scar tissue clean out. What's going on here? Doesn't this guy get it that doesn't work too well? The real part is, don't the surgeons get it? Because if I'm getting all these people in my office, I think the surgeons are getting a lot of people in their office for the same things where their surgeries have failed. I just met with an orthopedic surgeon yesterday. I need a good surgeon who's conservative, who I can send people to for second opinions, who's not just going to operate. And this guy was the guy.
That's pretty cool.
His name, by the way, I'll give it to you. I'll give it all to everybody right now, is Jonathan Koenig, Koenig. He's in West LA. He's across the street from me, and he is an angel, very honest. And I said, I need somebody conservative who's not going to just operate when I send someone there for a second opinion. He goes, I'm so conservative, I tell people it's best often not to operate. Now, this poor guy that just sent me this note says, I've been taking Norco for 7 years. Norco's a narcotic. That means he's addicted. So that's another problem that happens after surgery. So be careful. If you're going to do anything in medicine, do something conservative first. And regenerative medicine, using your own platelets from your blood or stem cells from your bone marrow, is about as conservative as it can get. It's simple. Anyway, let's get to our caller right now. So Kelly, let's see, your neck and shoulder are bothering you. How long has that been going on for? This is Dr. Marc Darrow.
Hi, Dr. Darrow. Good morning. The shoulder pain has been going on for over 2 years now, and the neck pain for over 10 years now. 10 years ago, an orthopedic surgeon told me I had degenerative discs in my neck, and really there's not a whole lot they could do for me, and that was 10 years ago. So obviously It's progressively gotten worse, and I didn't know what was going on with the shoulder, but I'll tell you, I did go to an orthopedic surgeon. He looked at my MRI, and so I have several things going on. I have the now severe degenerative discs in my neck, but I also have a tear in my rotator cuff. I have no idea where that came from, but because I've been dating it for over 1.5 years now, I have frozen shoulder. So I kind of just want to know, is this something that might be able to help me with these injuries that I have?
Yes. So let me give you a lot of information. You may want to get a pen and pencil, okay?
Okay.
You got one available?
Yes, I do.
Okay, so everything I tell you is my opinion. It's not necessarily the standard traditional medical opinion. So that's number one. Everybody's allowed to have their own opinions, right?
Right.
I've got mine. Surgeons have theirs. It's fine. We don't get along too well, but we all do things our own way. And the orthopedic surgeon I met with yesterday, Jonathan Koenig, didn't exactly like what I do for a living, in terms of using the amount of platelets and stem cells that I do. And he said they can fail. And I said, yeah, they can. Usually that's patient related, not the procedure related, because the patients don't listen to what I tell them to do. And then I said to him, what do you think about all the surgical failures? That's a big deal. If I fail, nobody gets beaten up. If there's a surgical failure, then it's a real problem. And he said, well, you're right. This guy's a real honest surgeon. I just fell in love with him in a heartbeat. So we talked about our philosophies and all that. And he said he uses, PRP, but he doesn't really think it's going to work most of the time, so he doesn't use it that much. And he doesn't do stem cells. And I said the opposite. I said I use it all the time, and I believe it works most of the time. The reason is because that's what I do for a living, and I've seen it work. I've used it, I don't know if you've listened to the show before, Kelly, but I've used it on both my shoulders, both my knees, both my elbows, my right wrist, and I've had other people, I can't reach my neck and back, but I've had my entire neck and back injected also. Every time I've used regenerative medicine on my own body, and I inject my own self on all the stuff I can do on the front of my body, I've had great success with it, okay? So I know this isn't a sham. I know this is not a placebo. I've had things that I had for years, like a shoulder. I've had both my shoulders frozen, by the way, just like yours is. From sports, and I had a surgery on my right shoulder which failed me miserably. It was during my last year of medical school when I was doing orthopedic surgical rotation, and I asked my boss to operate on me, and he did. And I loved the surgeon. He was an amazing man. But the surgery came out bad. My arm swelled up like a balloon, and I had a high fever from that. I learned about regenerative medicine later. I injected my own shoulder one time, and the next morning I woke up completely full range of motion, no pain. At that point, I became a total believer in this, and I've been doing it ever since. So, number one, frozen shoulders are generally pretty easy to fix. I can't guarantee anybody anything, but I've had both of my shoulders frozen at different times, and they're fine right now. I'm in front of a camera right now, and I'm lifting my arms up to show people that they work real good. I can do any sport I want to do. The rotator cuff tear that showed up on your MRI, I have 3 tears in my right shoulder, okay? To this minute, I have 3 tears. I have no pain. Why is that? Many reasons why. Number one, tears don't have to cause pain, okay? So what surgeons think about is finding something on an MRI and then fixing it, okay? But I have so many people that have been fixed by surgery, but they still have pain or worse pain than they had before. And then I can often fix them, if you want to call it fix. Their pain goes away, their range of motion becomes good by just injecting them with their cells from their own body, platelets or stem cells. So we have to understand that MRIs don't tell us where pain comes from. There are so many studies done with people that have zero pain in their body, and we find rotator cuff tears, we find labral tears, we find meniscal tears, we find degenerative disc disease like you have in your neck. We find all these things, but the people don't report any pain. Are you getting the message yet or not?
Yes,
Okay. So we have to be careful. Traditional medicine, high-tech medicine, uses a lot of imaging, and it gives often a lot of false positives, okay? Meaning that it shows something, but that thing isn't a pain generator. And also, MRIs can be overly sensitive. They may show a tear, and I've heard surgeons tell me this all the time. It's so weird. I did an MRI, I saw a tear, I opened the body up, and there was no tear there. Same thing with ACL ruptures in the knee. They go, I don't get it. I went in there to replace an ACL and anterior cruciate ligament, and it was intact. So be careful. Don't jump to surgery. If you're going to think about getting a surgery, listen, there's plenty of reasons to get a surgery that you need to do it. If you have a broken bone or your leg is dead or something like that, you got to get a surgery and pretty quick. So the things that you're talking about, to me, don't mean anything. Degenerative disc disease, everybody seems to get it as they get older, okay?
Mm-hmm.
That doesn't mean you have pain. I'm going to bet you anything. I don't know how much money you got, and I don't know how much money I got either, because my wife takes care of that. But I would bet you anything that it's not degenerative disc disease that's causing your neck pain. And the chances are that we can inject your neck with stem cells and or platelets and get it better regardless of the degenerative disc disease, okay?
Okay. All right.
Does this make sense to you, what I'm telling you?
Yeah, it does. It does, because when they told me I had a tear in my rotator cuff, I don't do anything strenuous other than I do play golf a couple times a month, but I don't know how that could be. I don't lift weights. I'm not a real athletic person, so that didn't make sense to me to have a tear. And then I wanted to ask you, Dr. Darrow, one other thing they keep doing is they keep sending me to physical therapy, and that honestly doesn't make my pain go away. I cannot sleep through the night because I constantly have to move because I'm in pain. No matter if I sleep on my shoulder, my side, doesn't matter. I can't sleep through the night because of the pain.
Okay.
And
So
I
a
don't
couple
feel
things
that
to tell
PT is
you.
helping.
Okay. So let me just explain a couple of things. Number one, the tear that was found on your MRI may have been there. How old are you?
I'm 57.
Okay. It might have been there 55 years. I'm all doing theoreticals because I have no clue. It may have been there 10 years. I don't know. And it never bothered you. And it may not be bothering you right now. Do you understand that? It may not be the issue. Right now you have a frozen shoulder, so you've got to very gently stretch it. And if you come in the office, I'll show you a stretching series. And I use a golf club on my shoulders every single day to keep them stretched. I use it as a lever to stretch out the shoulder. You got to do it very gently, twice a day for a couple minutes. That's all it takes. And I'm going to bet you we can get your shoulder unfrozen because I've done it with both of mine. Okay? My body's not unique. It's like everybody else's. So if you want to come in, the phone number to the office is 800-300-9300. I'll repeat it for you. It's 800-300-9300. There are people waiting by the phones right now if you want to talk to someone about more details. And for those of you that want to call and talk to me right now, I'm going to give you information you haven't heard from your doctors. It's 866-870-5752. That's to talk to me right now, right here on the show, 866-870-5752. Now, why are my opinions different than the surgical opinions? And I'm going to tell you this. I was in training to do orthopedic surgery. Okay? So I don't know everything about orthopedic surgery because I haven't been in the OR for a long time. But I do know the culture of orthopedic surgery, and I jumped the fence, and I got into regenerative medicine using PRP, platelet-rich plasma, and stem cells. And in the old days it was called prolotherapy because it worked on me. It was a mind blower. And when it worked on me, I started asking my patients, can I please try this on you? It worked on me. And no one wants to get surgery. So all my patients were like, yeah, please try it. And before I knew it, my practice was completely regenerative medicine. So be careful. I love surgeons. They do what I say is the hardest work in medicine. There's so many dangers and side effects. It's a big risk. So I take my hat off to the orthopedic surgeons for doing the work they do. Plus, it's really hard work. I've done, rotations in orthopedic surgery during my internship and residency, where we'd be on our feet for 12 hours a day in one surgery. I worked with an orthopedic surgeon in Denver during my internship who did revision surgeries, the ones that got screwed up by other surgeons. They'd go to him to fix it. And there was one that was just amazing. It was a hip replacement that had gone bad, and there was no more bone left. So he actually, this is going to be so weird to tell you, he amputated the femur bone, and we took a cadaver femur and carved it into the shape of this patient's femur bone and plugged it in. It was a long surgery.
Wow.
So anyway, I take my hat off to the surgeons. I love them. It's just that most of the surgeries do not need to be done and should not be done. The culture of medicine says they should be done, but my culture, in my experience, says they should not be. I've been deemed the devil for years when I first started doing this work, 20 plus years ago. But now even orthopedic surgeons are starting to do it. I have orthopedic surgeons that have come to my office to train with me to learn how to do it. So be careful, be conservative in medicine. Always be conservative. The best conservative measure is don't go to a doctor. The number 3 cause of death in our country, number 1, is heart disease, then cancer, and then iatrogenic causes, meaning medicine. Not necessarily the doctor's fault. It could be that they give someone a medicine and it interacts improperly and someone dies. It could be a surgery. It could be the doctor's malfeasance, but it's the combination of all those things. We call it iatrogenic medicine. You can look it up. And if that kills one, if that's number 3 on the kill list, stay away from doctors if you can help it. You get what I'm saying?
Yeah.
Any other questions, Kelly?
Okay. No, thank you, Dr. Darrow. It was very helpful. I appreciate it.
And the other thing is, go to my website because it has videos of me doing these procedures. See if it's something you want to do. Okay? The website is www.lastemcells.com, www.lastemcells.com, and you can watch me do the procedures. Okay? Some
great.
people
Thank
don't want to get injected. This is a real funny story. I had a third baseman from the New York Yankees. He was like number 1 in the world. Fly in from New York to see me for some pain he had, and I told him what I was going to do, and he said, "You mean you have to inject me?" And I said, "Yeah, that's how this works." And he goes, "I don't like needles." He said, "I'm going to get surgery." And I just laughed and I said, "If you get surgery, you're going to get more than needles. You're going to get the needles, and you're going to get the scalpel. And then you're going to get the after effects and the healing period and maybe some things you didn't want." Because I have people that come in the office almost every day who have had a failed surgery. That means a surgery that went bad. Okay?
Mm-hmm.
Now, I have a jaundiced eye about it, because if someone had a great surgery, they're not going to come in and see me. So I do only get the people where it failed. Make sense?
Right. Yes.
Okay.
Thank you, Kelly.
Well, God bless you. And
Okay,
you'll get a free copy of my book sent to you because you called in. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And I'm showing it to the camera right now. And it's just got an awful lot of information about sports injuries and arthritis and pretty much every part of the body I do inject. So hang with us, everybody. We're going to the break. And Nita, it's up to you.
Yes.
Take it.
You're listening to Living Pain-Free with Dr. Marc Darrow. Grab a pen or a pencil. Write down this important information coming your way. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, Call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.